So what about pregnancy after bariatric surgery? Well, first of all, if you've had bariatric surgery and if you want to become pregnant or you are pregnant, you've got to be connected with the bariatric team. And if you're not, then you need to get connected with the bariatric team in your local area. Obviously, the baby needs good nutrition and good vitamin levels for healthy growth, but I'll tell you that the most important part of the fetal development happens in the first 6 weeks before you even really know that you've conceived. And so the right thing to do is to wait until about 18 months after your bariatric operation to make sure that you have good nutrition intake and that you're taking your vitamins and that you work with your team to check your blood levels to make sure your vitamins actually are up to par, and then to work on becoming pregnant. My name is John Pilcher. I'm a bariatric surgeon in San Antonio. I've had the pleasure and honor of working with many of my patients who have been through pregnancy, and the results are mostly outstanding, but we want to do it the right way. One other key thing to know about is that fertility can improve amazingly in the first couple of months after bariatric operation. And so even if you're a woman who has gone into bariatric surgery with the experience that you can't get pregnant, I really think it's important that you use birth control until you plan to become pregnant at some future time. Now, having said that, obviously the change in fertility or the improvement in fertility has a very strong positive side that we're going to come to as we go along in this video. The cautionary notes that I use to open will apply equally to gastric bypass and sleeve, and the information that follows will almost all apply equally to gastric bypass and sleeve. Once we have the nutrition and the vitamin levels taken care of, the story of pregnancy after bariatric surgery is very positive. And the background is that women who are in the grip of the obesity disease face several problems coming from that disease. First of all, there are often fertility difficulties, actually difficulty getting pregnant. And when a mom with the obesity disease does become pregnant, she has a higher risk pregnancy, thinking about prediabetes, preeclampsia, eclampsia, larger babies requiring cesarean sections, and difficulty healing from those cesarean sections. And what's also not known as much is that the babies born to those moms with the obesity disease, the babies themselves have a higher risk of obesity through their lifetime, and diabetes and hyperlipidemia, etc. Now, the good news is that when those moms lose weight through bariatric surgery, there's a dramatic improvement in the fertility rates and the pregnancy outcomes, so that women in this situation have outcomes that are just about the same as the never obese population. And this information is coming from studies that have been done in a large number of women who have had babies before and after bariatric surgery. In my own experience, and my own patient population, I've seen up close to 130 healthy babies delivered to my patients, and this is one of the most positive things that we do. When I mentioned a moment ago that post-bariatric pregnancy outcomes are almost the same as the never obese population, I feel compelled to mention that the studies have shown that babies born to post-bariatric surgery moms are slightly smaller weight on average and are born slightly earlier than babies born to the never obese moms. In these studies, no other adverse outcomes have been associated with these statistical variations. Of course, many young women seek bariatric surgery because of a history of fertility problems, and they have the goal of building a healthy family. As long as the fertility team has not found any other problems interfering with conception, then the results of getting pregnant, or the odds of getting pregnant after bariatric surgery, are excellent. The tricky thing is that the reproductive hormones, estrogen, etc., can have improved levels even 1 or 2 months after bariatric surgery. So women in this situation who want to have a baby can conceive well ahead of schedule if they're not careful. And so once again, we just recommend that for women of reproductive age, that they definitely use birth control until it's time and it's a plan to deliver a healthy baby. Not only do young women have greater success in conceiving and delivering healthy babies, they tell us that they feel more active and more engaged with their children during their children's younger years and teen years than they feel they would have done at the obese stage. And I think also a woman who has had bariatric surgery who is healthier has better odds of being around and being active when grandbabies come in the fullness of time. And so there are also appropriate concerns about weight changes around pregnancy and how those relate to bariatric surgery. There can be valid concerns about not gaining enough weight or not gaining healthy weight, and there can be concerns about gaining too much weight or how do we get rid of the weight in the long run. As far as the side of not gaining enough weight, I can say that in my pretty extensive experience, I see pregnant patients after bariatric surgery have an appropriate increase in appetite level, an appropriate increase in food capacity, and an appropriate level of weight gain in most cases. I've seen the occasional patient gain too much weight, I'll come back to that, but so far have not seen any patients who needed medical artificial nutrition support or anything that led to a concern about the growth of the baby. And let's talk about that just for a second. So it turns out that the babies, this is from evolution, babies are pretty effective parasites. And so as long as we take care of nutrition levels for mom, we can be reasonably assured that baby is going to get what baby needs. And in fact, in my experience working with obstetricians, usually they will arrange a couple of extra interval ultrasounds to check growth patterns for the baby. And I think that's completely appropriate, but I haven't run into any cases where the growth of the baby has been insufficient. And that's just in the context of the mom having normal nutrition. Now back to the side about potential excess weight gain. Again, we're often seeing pregnancies in women who have previously had babies before their bariatric surgery, and the universal experience is that they don't gain as much weight as they did during their pre-bariatric pregnancies. And so we can extrapolate to say that women who have never had a pregnancy would also would have had more gain if not for the bariatric surgery. And most women gain an appropriate amount of weight, with a few gaining excess amounts of weight. And in a similar vein, most women, I would say about 80%, are able to successfully lose the pregnancy weight after delivery, but not 100%. And I think we have to confess here that pregnancy is very hard on the body. And pregnancy is one of these stress episodes, like some other significant illness, that can throw the metabolism out of balance through stress response, etc. And so this is a different angle in which the bariatric team ought to remain engaged, and can be helpful, especially after pregnancy, if there's any concern about getting the pregnancy weight back off. And one kind of non-bariatric plug here, it seems that breastfeeding is a very good thing to do for helping get the weight down to a natural level, and breastfeeding is good for the baby, of course. Now, there are a couple of expected concerns that come up for women who are pregnant after bariatric surgery, and a couple of rare, unexpected, problematic concerns. I'm going to kind of cover these in order. The three expected concerns that I'm going to address are around fetal growth, the right vitamins to take, and testing for gestational diabetes. And I mentioned a moment ago, fetal growth, in my experience with patients after bariatric surgery, has not been a problem. The obstetric team typically will want to do a few extra prenatal ultrasounds. I think that's a great idea, but I've never seen a problem after bariatric surgery in the context of pregnancy, growing healthy babies. Second predictable concern is about what the right vitamins are to take. And again, just to emphasize, it's really, really, really important to take the vitamins regularly before conception, if it is at all practical. And then it's obviously super important to take vitamins regularly during the pregnancy. Now, it's been studied and it's been shown that the bariatric vitamins are very sufficient for all of the pregnancy needs. And so a bariatric team can feel very comfortable in recommending continuation of the bariatric vitamins through pregnancy. However, the obstetric teams typically work under some pretty tight guidelines, and it makes them very anxious if their patients aren't on prenatal vitamins. And I've looked at prenatal vitamins. I think they're also sufficient for bariatric purposes, and so I've become, in my own practice, a little more agnostic. And I think the important thing is that a mom who is building a baby needs to take some vitamins of good quality regularly. And having said that, we can negotiate between the teams and be comfortable as long as some vitamins are going in. The third predictable concern is about testing for gestational diabetes. And granted that the rate or the percentage of gestational diabetes is way less in a mom who has had bariatric surgery than a mom who suffers from the obesity disease, still there are the obstetric guidelines, and still testing is appropriate to do. Now, the original and still the most common means of testing diabetes was for the obstetric team to give their patient, their pregnant mom, a sugar drink, a sugar cola, and to chug that thing down, and then just to check the blood sugar and find out what the blood response was. And the problem for that with both sleeve and gastric bypass patients, a little more for gastric bypass patients, is that the sugar drink is a completely perfect recipe for a blood sugar spike and a blood sugar crash, and a blood sugar crash that could and leading to seizures and such. So 10-15 years ago, this was a problem I would have to argue with my obstetric colleagues to avoid that particular test. The good news is that obstetric guidelines have been modified recently to take account of other potential means of testing, such as doing a set of blood draws for hemoglobin A1C, which is also a marker for diabetes, rather than doing the sugar test. Moving over to the rare, unexpected, and problematic concerns, there's one particular thing that may happen with gastric bypass patients in pregnancy, and that is bowel obstruction. And this is a situation where the gastric bypass itself leaves behind a very small but lifetime risk of bowel obstruction coming either from adhesions, which is scar tissue, or from a particular gastric bypass outcome called an internal hernia. And there is something about the growth of the uterus, it seems to be the case that the uterus grows and pushes things around, that seems to create just a little more percentage of either of these types of bowel obstruction showing up during pregnancy. And unfortunately, it's not weird for a woman who's pregnant to have abdominal pain or to have nausea, which are the main symptoms of bowel obstruction, and so it can be tricky to figure this out. So my message to you as a potential patient or provider is that if you're a pregnant person and you've had a gastric bypass and you've got abdominal pain or nausea that hasn't been figured out by your OB team, and give them a shot at it first, but have a low threshold for getting the bariatric team involved so that possibly additional testing or potentially even additional surgery can be done. Because the bowel obstruction can be dangerous, and especially if it's an internal hernia, it can lead to bowel, what's called necrosis or ischemia, and very critical situations for both mom and of course for baby as well. Okay, so this is just a reinforcement about having the bariatric team involved from the get-go if possible. The sleeve also has its own kind of problematic condition that comes up with pregnancy, not so rare. And here again, it's a growth of the uterus and a return of abdominal pressure. And the sleeve, which is predisposed to a certain degree to cause or to exacerbate reflux and heartburn, we see more of that in pregnancy. In my experience, when we see more heartburn and reflux in pregnancy, it goes away once delivery happens, although not 100% of the time. So I'm just going to wind up by repeating the message that I opened with, and that is that if you are a bariatric surgical patient, and if you're contemplating becoming pregnant, or if you are pregnant, you've got to have your bariatric surgery team involved. Having said that, the outcomes are usually awesome, and one of the things that we love most is growing healthy families. Stay well.